lot of good uptake. I guess there's also thoughts around maybe it just takes a little bit more time for awareness of this program to get out there. You know, we've had a lot of help around people suggesting really good ideas for marketing. We do have a very limited budget. It's a PhD project, so we can't afford kind of lots of advertising or anything like that. So, you know, that also might be a barrier there and might be explaining some of the low uptake. But when we do look at their barriers to treatment and their attitudes towards online treatment as well, we're seeing that there might be some additional reasons as well, that people don't have the equipment to access the internet. If they do, they don't trust it, particularly for maybe looking for, I guess, for treatment online. And that some amphetamine users are preferring face-to-face treatment because of the benefits that that could provide. So there's a few things coming through there. So I think even though there are some barriers to face-to-face treatment that could be addressed by providing treatment online, that there are additional barriers itself to online treatment that are different to those face-to-face barriers. So I think we have to be cautious of our expectations of online interventions for this population. I think we have to be cautious about how much it warrants putting resources into this, how much we should be looking at instead maybe putting more resources into the face-to-face treatments and putting resources into reducing those barriers around waiting lists and funding and availability of staff. I'm not sure, but I think we have to be very cautious that there are health professionals that I know of and other researchers out there that are very keen on the idea of investing a lot online. But I think we need to understand a lot more about what's going on there before we sort of throw too much money at it. The other thing I want to mention as well is that we are still recruiting for Beating the Rush, that one session checkup. So that's again at beatingtherush.com.au. So